going to discuss about the mucoepidermoid carcinoma. Okay, the carcinoma, I know, it's a epithelial malignancy. Why it's called as a mucoepidermoid carcinoma? It's called as mucoepidermoid because it consists of the two words here, muco and epidermoid. Muco means it contains the mucus cells. Okay, it consists of lot of your mucus cells. Epidermoid, why? Because it contains lot of your epidermoid cells or cells which resemble like your squamous cell. So that's why it's termed as your mucoepidermoid carcinoma. A carcinoma which consists of lot of your mucus cells and your squamous type of cells, that is your epidermoid cells. So that's why it's termed as your mucoepidermoid carcinoma. So moving into it. So what is this defined as? The mucoepidermoid carcinoma is defined as a malignant salivary gland tumor with varying degrees of aggressiveness. Okay, varying degree of aggressiveness, and it's composed of your mucus secreting cells and stratified squamous epithelial cells. I told, right, epidermoid cells. So it consists of your mucus secreting cells and your stratified squamous epithelial cells, nothing but your epidermoid cells. And since it's a carcinoma, it will not have a capsule. So it will not be surrounded by a capsule. So it is defined as a malignant salivary gland tumor which is of varying degrees of aggressiveness and consists of mucus secreting and epidermoid cells and which lacks a capsule. So that is the definition of your mucoepidermoid carcinoma. And I already told it's called as mucoepidermoid carcinoma because it consists of your mucus secreting cells and your epidermoid type of your cells. So the origin for how from I told it all your salivary gland tumors originates from the ductal units or the acini units. So same way from which ductal unit or the salivary gland unit your mucoepidermoid carcinoma arises. It arises from the intercalated duct and the excretory duct. Okay, it arises from the intercalated and the excretory duct units. So the cells of origin here will be your, it arises from the luminal cells of these two ducts or the abluminal cells or the reserve cells of these two ducts and the myoepithelial cells surrounding these two ducts. So it can arise from three cells, the ductal luminal cells, the myoepithelial cells and the basal reserve cells. So these three cells can give rise to variety of cell types. That is, they can differentiate into a variety of cell types. So going into your ductal luminal cells. So what does your ductal luminal cells give rise to or differentiate into? Your ductal luminal cells can give rise to your mucus cells or it's otherwise called as your goblet cells. It can give rise to your squamous type of cells or the epidermoid cells. Then it can give rise to either a cuboidal or the columnar type of your cell. And lastly, it can give rise to your glycogen-rich clear cells. Okay? It can give rise to glycogen-rich clear cells can also be formed or differentiated from your ductal luminal cells. So ductal luminal cells will form four type of cells. Your mucus cells or the goblet cells, the epidermoid cells, cuboidal or columnar type of cell, and the glycogen-rich clear cells. Okay, so these are the four cell types which will be formed from the ductal luminal cells. Moving on to your myoepithelial and the abluminal or the basal reserve cells. This myoepithelial and the basal reserve cells will give rise to intermediate type of cell. This intermediate type of cell is very important in case of your mucoepidermoid carcinoma because if there's going to be a lot of intermediate cells, it can be considered as a high-grade tumor. So your myoepithelial cells and the basal reserve cells will give rise to your intermediate cells, the epidermoid cells, again the squamous type of cells, the glycogen-rich clear cells, and your myoepithelial cells, again it can be seen there, and non-specific some cuboidal cells can also be appreciated here. So your myoepithelial cells and the basal reserve cells will give rise to your intermediate cell, epidermoid cells, glycogen-rich clear cells, non-specific cuboidal cells, and lastly your myoepithelial cells. So these are the cells which will be differentiated from the ductal unit. That will be your luminal cell or the abluminal cells or the myoepithelial cells. And if you see your mucus cells will be formed only from the ductal luminal cells and the intermediate cells will be found only from the myoepithelial component. So always remember this. So your intermediate cell is formed by the myoepithelial component cells and the mucous cells will be formed from the ductal luminal cells. So this is the pathogenesis or the histogenesis. If you take the histogenesis of your mucoepidermoid carcinoma, from where does your cells originate? So moving into the etiology, what are the source of etiological factors which can give rise to your mucoepidermoid carcinoma? So it can occur as a result of any therapeutic radiation in the head and neck region, which is the commonest etiological factor of your mucoepidermoid carcinoma. The second is the lipoidal installation. The artificial lipoidal installation can give rise to your mucoepidermoid carcinoma, and any foreign bought materials which can be seen in the body can give rise to your mucoepidermoid carcinoma. Entrapment of any foreign body. So these are the three etiological factors which are put forth for the development of your mucoepidermoid carcinoma: therapeutic radiation in head and neck region, lipoidal installation, and other foreign body entrapments within it. So these three can give rise to your mucoepidermoid carcinoma, the commonest being your therapeutic radiation. Next, the clinical findings. If you take the clinical findings, it is this malignant tumor, the mucoepidermoid carcinoma. It's considered to be the commonest malignant salivary gland tumor, and it is also considered to be a common pediatric salivary gland tumor. Pediatric meaning it's common in the children. The common malignant salivary gland tumor, which is common and seen in children, is your mucoepidermoid carcinoma. So if you see the age classification, it can occur in the 3rd and the 5th decade of life. And usually, since it's going to be a pediatric malignant salivary gland tumor, it is usually seen in younger than 20 years also. So the age classification, if you take 3rd and 5th decade, and sometimes less than 20 years also, it can be appreciated. And it's commonly seen in the females, not in the males. It's commonly seen in the females. The major site of occurrence, if you see, the major salivary glands. If you take the major salivary glands, it occurs in your parotid gland, followed by a submandibular salivary gland, and then your sublingual salivary glands. So these are the three major salivary glands which will be affected, and the order of occurrence will be the commonest will be your parotid, followed by your submandibular, and then your sublingual salivary glands. If you take the intraoral minor salivary glands, the commonest site will be your hard and soft palate. The commonest site of occurrence will be your hard and soft palate, followed by the other oral mucosal sites such as your buccal mucosa. The commonest will be your retromolar area, the floor of the mouth, and the lip region. So these are the other sites of occurrence of your mucoepidermoid carcinoma involving your minor salivary glands. So if you see the appearance, the origin, in case of your parotid or your major salivary glands, it occurs as a painless enlargement, okay, painless growth or a swelling of less than 1 year duration. So painless enlargement or swelling or growth of the major salivary glands of less than 1 year duration. And usually if you take the parotid gland, it occurs in the tail end or the body of the parotid and the entire submandibular glands or the sublingual glands. So painless enlargement can be seen with the duration of less than 1 year. And if it's going to be a high grade tumor, if you take a mucoepidermoid carcinoma, it has different grades. If it's going to be a high grade tumor, this growth will be associated with pain, facial paralysis, and fixation to the overlying tissues or the overlying skin. So fixation can be appreciated if it's going to be a high grade tumor. And if you see the dimension or the tumor size of it, it will be around 1 to 4 centimeters in size. This is all for in relation to your major salivary glands. If you take your minor salivary glands, it will be usually seen resembling like a mucocele. I think already mucocele has been taken for you. So it will resemble like a mucocele, and usually it will be an incidental finding only. Your patient will not complain of any pain or such. So it will be an incidental finding. So how it will appear? So if you take your intraoral lesions of your mucoepidermoid carcinoma, it will be a smooth surface, dome-shaped lesion or dome-shaped lesion, which will be smooth surface. It will be either purplish in color or blue violet in color, okay, purplish or blue violet color, and it will be fluctuant. So all these findings will resemble give a differential diagnosis of your mucocele. Similarly, mucocele is what? Clear fluid with a fluctuant mass. So similarly, it resembles like a mucocele, but the color, if you take the color, it is a blue violet or a purplish in color. So it can resemble like your hematoma also, a hematoma or a hemangioma also. The differential diagnosis, clinical differential diagnosis will be either a hematoma, hemangioma or a mucosal. Along with these findings, I told it's a smooth surface, dome shaped, fluctuant swelling. The color will be around bluish purple to blue violet in color. Along with these findings, sometimes there will be an opening on the top of the lesion where the mucus secretions can be seen out. If this lesion is seen in relation to any alveolar mucosa, it can be confused with your dentoalveolar abscess. So the DV in case of the alveolar region, it can be a dentoalveolar because it has an opening and through which the secretions are coming out. So it can resemble like a dentoalveolar abscess. So clinically, it will just be an incidental finding. That's what you can think of all these clinical differential diagnosis. When you take a biopsy only, you will come and to know that it's going to be a mucoepidermoid carcinoma. So if you do clinically, it's going to be a smooth surface, dome-shaped lesion, and then it will be blue-purple or bluish-purple or your blue-violet or purplish in color, and it's going to be fluctuant. Sometimes the opening can be seen through which the secretions are coming out. Usually it will be a painless lesion. And sometimes focal erythema can be seen. The erythema or the erythematous areas surrounding it can be appreciated. So in here also, if you take a low-grade tumor and a high-grade tumor, in case of a low-grade tumor, the duration is around more than 1.5 years duration only. Whereas in your parotid or the major salivary glands, it was less than 1 year. Whereas here it can go up to 1.5 years. So it's a very slow growing lesion or slow growing tumor of about 1.5 year duration, and the measurement will be very small only. Okay, less than 1 to 2 centimeters in diameter. It's going to be a small lesion and it will be a painless lesion. It will not have any ulceration and all. Whereas in case of your high grade lesion, what happens? You will be seeing any ecchymosis or erythema can be seen, ulceration can be seen surrounding the area, and then sometimes it will be associated with pain, and facial nerve paralysis can be appreciated, paresthesia can be seen, and then sometimes trismus can also be appreciated if it's going to be a buccal mucosa area because of the fixation to the overlying tissues. So here also, if you see, low grade will have not much of symptoms, whereas your high grade will have lot of your symptoms will be like your pain, your trismus, your ulceration. All these can be seen in case of your high grade intraoral lesions. So this is a picture showing the palatal lesion. It's a smooth surface dome shaped lesion. Sometimes a normal color or a little bit purplish color can be appreciated. This is another picture showing the smooth surface fluctuant blue, violet, purplish lesion. And this is in the retromolar area. This resembles typically like a mucosal, a smooth surface lesion which is clear and it's also appearing fluctuant. So this will give a DD of your mucosal. But when you take a biopsy and see, it is going to resemble like your mucoepidermoid carcinoma.